Welcome to Chapter 5, Medical Terminology. We've talked about before the importance of communication as an emergency medical technician, and a large part of that is going to be you guys' ability to effectively use medical terminology, understand them in their written form, maybe even some terms that you're unfamiliar with, being able to utilize the rules and know how their words are made in order to take them apart to understand them. Directional terms is very important to be able to use to describe where injuries are located or describe how pain is presenting itself on a patient to another medical care provider. And like a lot of the concepts we're going to learn as a EMT, you may not pick all of this up the first time around. This is more of something that we're going to be working with constantly as we review and throughout your careers. But in this chapter, we're going to talk about the basics, and it would behoove you to follow along in your books so that you can refer back to the reference tables as we talk about it, or at least after this lecture, when you have a chance, review and read the chapter. And they have a couple of tables that have some terms that are frequently used for the root words, the prefixes, and the suffixes, and that'll greatly help your understanding and utilize medical terminology. So let's begin. So EMTs need to have a working knowledge of medical terminology. This helps out so that we are on the same page when we're describing something. It makes it so that it's easier for us to be more specific about a location, whether it be pain or an injury site. And also when we're reading other medical documents, so we can break down some of these more difficult words, because other doctors, nurses, their notes, oftentimes we need to transport patients, and we need to review through their charts, and they utilize medical terminology, so we have to be able to break down these terms. We need to understand the key terms. So a lot of the root words, anatomical locations, proper terms to describe things. Acronyms, we need to understand those. How we say acronyms and also what they mean, so that we can be on the same page. Symbols, there's some symbols out there that we need to know about, so we'll spend some time looking over those, as far also abbreviations. Be careful with abbreviations, especially when you're kind of wanting to utilize medical terminology. Get out there and use abbreviations. It seems like people want to use them when they document their narratives, which is acceptable. Make sure that you look online and see what are approved abbreviations, or when you get to your local area, what's approved as far as abbreviations go. But also realize there can be some ambiguity with abbreviations, meaning it can be difficult to understand. Sometimes they get misconstrued with something else. So that's why we want to make sure that we are aware of the standard abbreviations. I mean, definitely like blood pressure, utilizing BP. That's fairly standard, and it's much quicker. But sometimes you'll see. As we utilize abbreviations, it can actually complicate things more. Yeah, when writing it, it saves time, but if it makes it more difficult for the other person to understand what you're trying to say, maybe it's not worth that time it saved you to initially write it. I urge that definitely in the narratives as well. I try not to use too many abbreviations, because though maybe somebody that has medical training would be able to read it, realize that these PCR narratives are a legal document, and if we get subpoenaed, they're going to get brought up. We'll have to testify and explain the meaning of them. And if your report can stand on its own, somebody, a layman or somebody not in the medical field can read it, it'll make it that much easier for you to be able to explain it without having to then go in and decode and explain every abbreviation that you wrote down. But obviously, like blood pressure, BP, there's some standard ones. We'll go over those and be practicing with them as well. So we need to determine the meaning of an unknown word. First, we have to understand how that term or that word was formed, right? So the good thing, even though it's literally kind of learning a new language, a lot of this derives from Latin. Thankfully, it has rules that apply a lot more consistently than in English. So we'll be learning about that and why there'll be some vowels or some things that are changed in there when you're combining a root word with a suffix or a prefix. And what this allows us to do when we understand that is when we can break down maybe a word at first glance, I have no clue what that means, right? And this could be in a medical report or on National Registry, is pretty known for doing this, even if they're just throwing it into a separate answer to kind of throw you off. And if you remember these rules that we'll go over, you'll actually be able to decipher what that term is meaning. We also need to learn the definitions of the parts of a term, so the root word, the prefix, and the suffix. Understanding medical jargon leads to effective communication. And kind of on this note, I'll take this time to say a lot of our job is bridging the gap and communicating between medical personnel who understand medical jargon and who expect it, right? And may speak with you in those terms, and we'll expect you to use terms like hypertension instead of high blood pressure, right? But then the general population, they may or may not be familiar with those terms. They understand probably what high blood pressure is, but maybe not hypertension. So we have to kind of be able to switch gears back and forth inside our brain so that we can be communicating and talking with the public easily, or with our patient, and then again with other medical care providers. And kind of on that same note, though I really want to urge you, especially in this class, to utilize medical terminology whenever you can and be practicing it so that you get better at it. If you ever find yourself unsure about a certain medical term, always kind of default back. It may take a little longer, may not be as specific, but just using layman's terms, right? Because it's more important that we're accurate than we're making an attempt to utilize these medical terms just because we think that it sounds more professional, right? It's definitely more professional to be more accurate than to be sounding like we're being more professional, if that makes sense. So medical terms are made of distinct parts that perform specific functions. This is when we talk about the different parts of the words, the root word, the prefix, and the suffix. Changing or deleting any part can change the function, meaning of a word. We'll see that with, we have what we're talking about, tachycardia or bradycardia, right? The root word there, cardi, meaning heart, and then we have the prefix, which would be tachy is rapid or fast, brady is slow. So there's a big difference whether it's tachycardia or bradycardia, right? And some of these might be a little bit more subtle, right? Like the prefix a, just the simple a is without, right? Atraumatic, without trauma. Asystole, right? When we think of that, asystole or a flat line is an electrical rhythm. Usually they're not generating a pulse electronically or physically. So systolic would be our systolic blood pressure is the pressure when the heart is pumping, right? That's that high number, 120 over 80. The systolic pressure is that 120. So systole is when your heart's pumping. So what is asystole? Without pumping, right? So the heart's not moving. So, understanding these small, changes that you can do in when you're utilizing these words or when you're decoding them yourself is really important. Components that comprise these medical terms that we spoke of before would be the word root, right? This would be like cardi is heart, hepat, liver, nephra, kidney, neuro, nerves, psych, mind, thorax, chest. And then the prefix, hyper, hypo, tachy, brady, pre, post, right? And then some suffix terms would be pathy, such as disease, megaly, enlargement, itis, inflammation, and then combining vowels. We'll talk about some of those to, let's say we want to make cardiology, right? So cardi, C-A-R-D-I, would be the heart, and then the study of, which is just L-O-G-Y. But to make it kind of, so we don't have those two consonants together, we add an O in the middle of that. So cardiology, we add an O right between the root word and then the suffix. So let's talk about how these parts of the term are combined and how it determines the meaning. The accurate spelling is essential, right? So when you're looking at these, it can be easy to kind of mix up neuro or nephron, right? Kidney and nerves, big difference there. And then here's another big one that we're going into is the phagia, meaning speaking, and phagia, meaning eating or swallowing. So dys means difficult or painful. Dysphagia means difficulty speaking, where dysphagia means difficulty eating or swallowing. So you can see how terms like that, the spelling, yes, definitely important, but also pronunciation, can be difficult. And then again, if you're having any question or anything like that, just difficulty speaking, right? I know it's dysphagia or dysphagia. I can't remember which one, right? Especially if you're giving an oral report on the radio or in person, then just take that medical term out of there, right? Difficulty speaking. Obviously we're going to constantly try to practice these, but sometimes it's can be difficult, as you can tell with these two words that mean something, very different, right? And then so to take that kind of ambiguity out of it, you may just break it down just to layman's terms. And it may take a little bit more time, but it'll be more accurate. So how these terms are combined is also important. We need to have a good knowledge of the anatomy. And then the context of how the words are used. This is definitely important when we start talking about directional terms, which are super important. We have some, and we'll go over those in just a second, but the difference between medial and lateral, which towards the imaginary midline that goes to the center of the body, and then we have proximal and distal, which are terms that relate to how close to the trunk of the body. Now it can be easy to kind of get these a little bit mixed up, like utilizing if we're talking about the eyes in relation to the nose, you may want to say, oh, the eyes are distal to the nose, right? But proximal and distal are only pertaining to their correlation of how close they are to the trunk of the body. So medial and lateral are better than that. The eyes are actually lateral to the nose. So we'll be kind of reviewing that too. Just realize what context these terms are meant to be utilized in. And in the beginning, there's going to be some, as you're practicing utilizing them, some mistakes that are made, and that's okay, and that's understandable. But it's important to be as specific as possible. So word roots, main part of the stem of the word, conveys the essential meaning, frequently indicates a body part. As we said before, cardi is heart, psych, mind, thoracic, chest. So we're going to want to be able to try to identify these root words and realize that a lot of them are going to have that kind of derived from Latin. And so once you know them, you'll be able to kind of at least be on board of realizing what part of the body they're talking about, and that combined with the context, if you understand that, then you may be able to decipher this a more complicated word. So add or change a prefix or suffix to change the meaning of the term, right? Cardiopulmonary breaks down into cardio, so that's a root meaning heart. Pulmon is a root meaning lungs. During CPR, or cardiopulmonary resuscitation, you introduce air into the lungs and circulate blood by compressing the heart. So you can have two root words that are connected to make up, in this sense, cardiopulmonary resuscitation and cardiopulmon, the heart and the lungs together. Prefixes appear at the beginning of a word, as it implies, right? Prefix usually describe location or intensity, right? So we're talking about hyperventilation. So hyper is over, excessive, or high. So if you're hyperventilating somebody, then that means you're ventilating them too excessively or too high, or you're overventilating them, right? So by understanding these prefix, they give us an idea of what they're talking about on that root word. We have these in our general languages as it describes here: autopilot, right, submarine, tricycle. And not all medical terms will have a prefix. We talked about cardiology before, right? Cardi is heart, and then the ology, study of, right? So study of the heart would be cardiology. Has that O that kind of adds in the middle there to make it easier to pronounce. but there's no prefix, right? There's nothing saying that it has to have a prefix, but it does have a suffix. So we'll talk about a little bit how when we break this down, we usually look for this suffix first and the prefix, and then we try to identify that root word. So the prefix gives the word root its specific meaning. For the word root pnea, right? So that's again for air. We can add the prefix a without apnea, without breathing. Bradypnea, that's going to be slow breathing, or tachypnea, which would be fast breathing. This creates, three very different terms. So understanding those prefixes will really help us, even if we understand the root word. If we don't understand what the prefix is, or we get Brady and tacky mixed up, then we're going to be way off what we're trying to achieve by saying, or we're not going to have an understanding of what they're talking about. And like I said before to you guys, I'm going to start introducing this medical term, especially, bradypnea, bradycardia, tachypnea, tachycardia, A without, asystole, apnea, as much as I can in class to kind of get you guys used to hearing that. And I, challenge you guys to try to use these words as much as possible yourself. But by learning these commonly used prefixes, you can figure out the meaning of unfamiliar terms, right? Because Brady is always going to mean slow. Tacky is always going to mean fast or rapid. So when you guys are following along in your book here, or when you go back into your reference text, look at these common prefixes, these common roots and common suffixes. And, they'll go a long way if you just know even those specific ones. Suffixes appear at the end of words, usually indicate a procedure, condition, disease, or a part of speech, right? So we'll of those. Commonly used ones are like itis. Itis means inflammation. So if we break down the word pericarditis, peri means around, cardi is the heart, and itis, inflammation. Pericarditis is an inflammation of the sac around the heart, right? So even if we did not know what pericarditis was, if we knew these medical terms and these prefix, suffix, and root words, we'd be able to break that down. Another one that this is talking about is with arthritis, right? Athro meaning joint, and itis, inflammation of. And then put those together and you got arthritis. And then notice the difference of taking out just essentially the O for athro for joint, just to combine those together, right? There's going to be there's some rules to them that we'll go over here at the end, but a lot of them you're just going to kind of pick up through repetition, right? Most of us know what arthritis is, and then as we break it down, now we know it kind of works in reverse, right? If you know what arthritis means, but maybe you didn't know what athro meant. You didn't know athro meant joint. Well, now that you have an understanding of how these words are put together and how they're made, athro may not be too far of a stretch, right? To say, oh, that probably has something to do with a joint, right? So this kind of works in both ways when you're building words, but definitely when you're breaking them down. So combining vowels, this is what we're kind of talking about, connecting words, roots, suffix, and other word roots together. Most cases an O may also be an I or an E, used when joining a suffix that belongs with a consonant, another word or root. So some examples here. When we talk about gastroenterology, right? Gastro meaning stomach, interior intestines, and ology, study of. So when you break that down into its separate parts, you get an idea of what they're talking about. When you had a first look at the word gastroenterology, I don't know what that word is. I'm not familiar, right? Maybe it has something to do with the stomach. Okay, well, what part of that word do you know means stomach? Well, I know gastro does, right? Well, then what's entero mean? Okay, well, intestines, you may have to look that up in order to break that down, but then we should all be starting to get more familiar, especially with the LOGY, study of, right, ology. So this is just an example, kind of a word that once it's combined, we may not be that familiar with, but we are familiar with its basic parts, right? And this is going to take some time, especially putting these kind of words together. But it's well worth it, especially when decoding charts, when trying to understand some of this medical jargon. So now let's look at the combining vowel, as they said, with the root word. Um, some common forms here: cardio, right? Cardiologist, gastrointestinal, and then understanding just the root words that we may not be familiar with, like liver, right? Hepatic, athro for joint, osteo for bone, and then pulmon for lung, right? Pulmonal. Um, Understanding these root words will help us at least get us close to sometimes when there's a larger word that we may not be able to quickly identify. Just look for the root word and understand, hey, even if I'm not picking up exactly what that root word is, be looking for these combining vowels. That'll help us. So the rules of building these. Um, the prefix is at the beginning of a term, the suffix is at the end of the term, and then we utilize these combining vowels that we were talking about in the previous slide. The suffix begins with a consonant to ease pronunciation, and a term has more than one root word, could, right? Cardiopulmonary arrest. Realize that, and it also may not have a prefix. But by understanding how these words are built, that more helps us for being able to decode some of these more complicated words. So now we're going to take a look at the plural forms of some of these words. To be perfectly honest, a lot of these you're probably just going to kind of memorize or pick up on from using them. Um, Even as I'm looking through them, some of this I realized, oh yeah, okay, I'm used to seeing the plural form look like that, but I didn't necessarily in my head pick up on the specific rule that changes it. Like for apex, ex or ix changes to aces, right? Apices. So it's just kind of I'm just generally used to seeing that, understanding that word. But we'll go over these rules. As far as A, we'll change to AE, right? Vertebra to vertebrae. IS, we'll see to ES, diagnosis to diagnoses, the apex to apices that we just spoke of. Um, on or change to A, like ganglion or ganglia, ovium to ova. US change to I, bronchus to bronchi. Right, so these just by kind of picking up and realizing that there is going to be a change of this root word when you go to a plural one, and whenever you see it, kind of try to remember that for when you'll see it again in the future, because there's a lot that we'll see quite a bit, right? The bronchi, right? Bronchus, bronchi. Those are going to be ones that you're going to see fairly often. So some prefixes, what do we use the prefixes for, right? Prefixes generally they'll indicate numbers or colors, position, and directions. That's what we use them to utilize. Some ways that we can numbers, right? Some prefixes indicate that a term involves a number or two or more parts or sides, right? So all different ones here. One, dipla, two, null would be none. Primi, first. Multi, many. Bi is two. Goes on from there, right? Tri is three. Quad is four. So there's many of these. By being able to pick up that prefix and understanding that's meaning, it will help you out because it'll greatly change, right? There's a big difference between null and uni, right? It's none, first one. So we're going to try to practice utilizing these terms, and some of them you'll just get like bilateral, right? Both sides. That's going to be one that we're unilateral, be able to pick up on. So colors, several words, roots described colors. Example, cyno, right? Cyno would be blue. Cyanosis, bluish discoloration of the skin. Leuco would be white, like leukocyte. Right? They have elevated leukocytes. Would be elevation of white blood cells for infection. Erythro, red, right, for red blood cell. grow yellow, orange. That's kind of indicative of jaundice, or referring to a liver that has inflammation causing that yellowish orange pigmentation of the liver. So, some of them are going to be more less common, right? Um, Meleno, that would be pertaining to black melena, would be black tarry stool, right? Typically carrying upper GI bleed, something of those nature, but definitely cyanosis, leukocytes, erythrocytes. I mean, those ones for sure. We're gonna be using them a lot. The other ones, Carijo and Meleno, just being able to break those down in maybe a more complicated word is kind of going to be the use for understanding those prefixes, at least for this course. All right, now let's review the position and directional terms. Examples would be ab for abduction, right? This would be describing you lifting your arm up away from your side, abducting. Um, and then the opposite of that would be adding your arm to your side, adduction, right? And may need to utilize this term when describing when something hurts, when somebody does a certain movement, right? Because the muscles associated with that would be telling us kind of an area where there may be an injury. D would be down, away from. Circumferential, all the way around. Circumferential burn is another one where we utilize this medical term that you have a burn all the way around the arm, and kind of the importance of identifying that or noticing a burn with that is after that burn, your body starts to initiate some swelling, the cascading of the histamine release, and if it's swelling all the way around the arm, it's going to be restrictive of blood flow, and it may allow blood to be able to, under pressure in your arteries, to be able to pass through that circumferential burn, pass through that band that's kind of tightened around the artery there. But it's the tightness of that band is reducing blood flow to return through it, because the venous system is under low pressure, and so that venous system, what we discussed before, right? That's what brings back that waste product back from the cells, that more acidotic type blood, and if that builds up, that could become real dangerous. So, circumferential burns are a big problem and need to go to a burn center because of that. Kind of change the way that we view this patient, right, and how stable they are. Peri would be around, right? Pericarditis is referring to the cardium, or the heart muscle, but it's the sac around it, right? And it's an inflammation, itis, so pericarditis, peri meaning around. Trans, it refers to across, through, or beyond, right? It's like transdermal, be a medication that we can put topically on the top of the skin, and it passes through that skin, through the dermis, transdermal. Epi, above, upon, or on, and supra, above or over. So these are just some examples of some directional terms, which are in position terms, really important for us to kind of get a grasp, especially on these prefixes. Understand the different directional, number, and color. So now let's move to common direction, movement, position terms. These are going to be extremely important for us to be able to grasp when we're describing where injuries are, how pain is kind of moving through the body. And when we do this, we're going to be talking about the patient's, the direction in reference to the patient, and when they're in the anatomical position, as you'll see right here, right? With the patient sitting, staring at you with the hands kind of at the side. That's what we consider the anatomical position. This helps us, like we said over there, where injury is located and how pain radiates through the body, which might change where we suspect the injury is occurring from. So some directional terms include right and left. It may seem simple enough, but the big thing to remember it's the patient here. They're right and their left in terms of them standing in the anatomical position. Oftentimes when I'm about to give a report or writing, I'll kind of close my eyes and then look through my mind's eye and think about how the patient is sitting, right? So whatever you got to do to make sure that you get the right location, because it can throw you off sometimes thinking of your right and your left, right? So it's always the patient's right and left. Superior and inferior. So over here we see superior is above and inferior below. And remember with these terms, they're always in relation to something, right? The chest is superior to the pelvis. Or this, we can talk about the chest, maybe they have chest pain, and it's kind of at the top side, right? So it's at the superior aspect of the chest. But we always have to give something relative so that we know what we're referring to. Lateral and medial. So this is imaginary line that cuts the body in half. That's the midline. So anything closer to that is medial than something that's further away. Again, these are relative to each other, right? So if it's closer to the midline, then it's medial. And then if it's further away, it's lateral. This is different than the proximal and distal, right? Proximal and distal refers to an appendage or something that as it refers back to the trunk or the core, right? So yeah, your elbow is proximal to your body versus your wrist, right? But if we're talking about the eyes and the nose, your eyes would be lateral to your nose. They wouldn't be distal, right? Because that's referring to the midline and laterally. The other one, we're talking more about appendages here. And then superficial and deep, just as it sounds, right? Like if we're talking about a burn, superficial would be kind of more of a sunburn versus a deep or full thickness burn. The one with, when we're talking about superficial and deep, it can be just in those kind of vague terms, or you can identify them with, you know, it was a deep 3 mm laceration, right, at its deepest. So you can add to it. There's not a specific, well, how far or distance-wise, what makes it deep versus superficial, right? These are more they're relative to each other, right? It's more superficial than it is deep, so deeper than it is superficial. So if you define that, you can, or you can just stick with the general terms. So these directional terms are some of the more or less common terms, but it may be something that might show up on National Registry, or you may see it in someone's patient care report or a document from the hospital. So ventral and dorsal, you can think of those as the anterior and posterior. And think of dorsal as like a dorsal fin on the back of a dolphin. So dorsal is the same as posterior of the back there. Palmar and plantar. Palmar is like the front of the hand there, is the person standing in the anatomical position, the front side. And then the plantar would be the bottom of their foot. And then the apex is simply the tip of a structure. For example, the apex of the heart is the bottom inferior portion. So you may see these, not that I will hold them to you, to utilize in class to describe things. We'll stick with the more anterior, posterior for our directional terms in class. So superior and inferior. Superior near to the head, inferior near to the feet, as we described before. Terms describe the relationship of one structure to another. So example, the knee is superior to the front, to the foot, and inferior to the pelvis, right? So and kind of like I said before, or like the aspect of the chest, right? He has pain in the superior aspect of his left chest. That's real deep, right? So you can utilize these terms in that regard as well. It doesn't have to be one anatomical structure compared to another one. It can talk about a region and then giving reference point to that general region. And that kind of helps be more specific where this location is for an injury or pain or something that you see. Maybe a rash or something like that, an old surgical scar. Now we'll go into lateral and medial. Lateral, body parts that lie farther from the midline. In general, lateral means the side. Medial, body part that lies closer to the midline. And a big one where we use this, and we'll kind of change a patient, is let's talk about a patient that was involved in a fall or a motor vehicle accident. And then they describe that they have back pain. right? Well, is that back pain medial, meaning is it on the midline, is it on their spine, or is it lateral, maybe more there on their side, right? Is that might change even how you treat the patient. Patient has back pain after a fall, but it's medial, it's on the side, it's not on their spine. We're probably not going to be putting on them in C-spine. Whereas if they have pinpoint pain on their spine, the pain is medial. That might be why we put them in C-spine. So this is a good way to be able to describe, right, to other healthcare personnel and maybe why we did or didn't do something. This example, 5 centimeter laceration on the medial aspect of the thigh means towards the inside of the thigh, right? Notice how they use the whole thigh kind of as a region, and then at what aspect of that? If we're talking about just the thigh, then where is this cut in relation to that, medial or lateral, right? Before we were kind of talking about it in terms of one body anatomical location to another, but we can also just be more specific in a certain area. So now we're going to be talking about proximal and distal. And the point to make a note of here is this describes the relationship of any two structures on an extremity, right? We use proximal and distal when talking about an extremity. Proximal's closer to the trunk, distal's further away. Your hands are distal to your elbow. Another way I like to think of this would be when we're, let's say, applying a tourniquet, right? Are you going to apply the tourniquet proximal or distal to the injury? Hopefully you say proximal to it, right? You want to try to apply that tourniquet just proximal to that injury to stop them from bleeding out, but to preserve as much tissue as you can before you have to apply that tourniquet, right? So this is just another directional term, but only in relation to the trunk. Superficial and deep. Superficial means closer to the skin, deep's farther from the skin. These terms are just relative to each other, so they can be fairly vague, right? If a cut is superficial, you're thinking it's just a scrape, barely, maybe not actively bleeding, not much blood loss. Once we start getting through the dermis, then we're talking about a deep injury. Now, if you know exactly how deep it is, or you can approximate fairly well, then maybe you might want to say, yeah, it's 3 millimeters deep, right? But from all intents and purposes, we're good with you just utilizing superficial and deep for what we talk about when we're passing on reports. This is using an example: superficial burn, just a sunburn. Deep laceration, cut deeper into the tissue, such as you'd expect with a knife, right? Now brings us to the ventral and dorsal. Ventral, as it says, refers to the belly side or the anterior surface of the body. Dorsal refers to that spinal side. Oftentimes we think of a dorsal fin, of the dolphin, so that would be the posterior side or the back, the spinal side. That's how we keep them straight. But more oftenly we refer to anterior and posterior. So this is as it says, anterior is the front surface of the body, posterior is that back surface of the body. Palmar and plantar. The palmar surface, front region of the hand or your palm. The plantar surface is that bottom of the foot. And again, if you can't keep these straight, what would you default on if they had a cut on the bottom of their foot there? Well, they had a cut. You try to be as accurate, maybe where it is positionally. They had a cut, in the back posterior portion of their heel towards the bottom of their foot. Or you could say, towards the plantar side. And it kind of all depends. But when you're in a pinch, like I've said before, default to utilizing layman's terms so you can be more accurate. Apex, or the plural version, apices, tip or tips of a structure. The apex of the heart is the bottom inferior portion of the ventricles. So some movement terms, flexion or bending of a joint. Another thing I want you to think about when you think of flexion, anytime a muscle flexes, it becomes smaller, right? When you flex your bicep, when you bring your arm in and flex that muscle, it becomes I know we think of it, well, we're flexing to make it look bigger, right? But really, when it's extended out, that muscle is flattened and it's much longer. And then when we bring it in and we flex, it's actually making it smaller. Reason why I want to have that kind of review over that is when we think of your diaphragm's a muscle, and when it flexes and when it contracts and it gets smaller, that's actually lowers and gets smaller in your chest, making your thoracic cavity larger, right? And so the pressure inside your chest is lower, so that air can actually move in just because of the difference in the pressure gradient, right? I don't know what it is. Maybe it's thinking of muscles, people flexing and showing off, but we often think, oh, flexing is bigger, and that kind of screws us up, especially when we think about the diaphragm. So when you think of flexing a muscle or contracting it, realize that it gets smaller, right? So the opposite of that would be extension, straightening of a joint. Straightening of a joint and also that muscle would elongate and actually get bigger, right? Adduction, motion towards the midline. So when you move towards the midline, you're moving towards your body, you're adding to your body, right? So adduction. Where abduction is motion away from that midline when you're taken away from your body. Some other directional terms: bilateral, both sides of the midline. Eyes, ears, hands, feet, right? Everything you have bilateral. When we hear lung sounds, we're going to listen to lung sounds. Lung sounds are equal and clear bilaterally, right? That means both lung sounds are equal to each other and they're clear. We hear good breath sounds through them. The chest moves. When they take a deep breath, moves bilateral. Unilateral would mean one side was moving opposite of the other, right? So that'd be indicative of, a um, potentially got a tension pneumothorax or something that's obstructing that side of the lung. Structures inside the body also appear both sides of the midline, lungs and kidneys. Unilateral, only one side of the body. Unilateral chest expansion, kind of we were discussing before. Other directional terms, the abdominal cavity is divided into 4 equal quadrants, and a lot of times you will see these abbreviated, right? Right upper quadrant would be RUQ, left upper quadrant LUQ, right lower quadrant RLQ, and LLQ. And so just it's separated just with an imaginary line straight down the midline and kind of through the center there. To describe where these positional terms, these cavities are. All right, so we need to learn these concepts to describe the location of an injury or our assessment findings, so that medical personnel will know where to look, will know what we're describing. And I kind of talk about this about when we'll get into trauma and we're given reports about it. It's very important that you're, as accurate as possible and that you describe every injury that you see or every inconsistency as you do your physical exam, because that gives the medical provider that's taking the patient after you some confidence that, yeah, they even spoke of this small abrasion. It's not even actively bleeding, not even that notable, but they spoke of it just proximal of their left wrist on the lateral side, right? And we can describe, oh, that's exactly the one they're talking about. It's right there. And if they even mention that one, if I see something else, they didn't see it, right? If I see something that they didn't describe, they must have not seen it. So it's kind of important that we're, on the same page and we speak as accurately as precisely, so that when they see something, they know it's what we had mentioned, because it's exactly how we described it. Medical terminology is very specific that way. And then anatomic positions. There's a few different positions that we'll utilize, right? Prone or supine. Prone means you're laying face down. Supine, a good way to remember that, you're on your spine, so you're laying on your back, right, face up. And then the Fowler's position. Fowler's position, true Fowlers, they have the Fowlers, high Fowlers, low Fowlers, and this is all the degree that they're sitting at. The term that we generally will use, we'll use semi-Fowlers. Let's speak of that on the next page here. So semi-Fowler's position, patient sits at a 45-degree angle almost up until you're at that high Fowler's, that 90. So I don't know if it seems more forgiving, if you describe a patient sitting semi-Fowler's, but most of the patients, that we transport on the gurney, we're not actually going to have them in that high Fowler's position, or the true Fowler's. They're going to be somewhere at 45 in that angle. So we often refer to them in the semi-Fowler's position. Fowler's position is just a position used kind of pretty much sitting up just because it's easier for you to breathe in that position. Most of the patients that we have, or a lot of them, could benefit from it being easier to breathe. You can utilize, almost 50% more of your lung surface area in order to oxygenate when you're sitting upright in a position to allow for that full lung expansion. So that's why we try to utilize these positions, but oftentimes people aren't in that high Fowler's position. They're somewhere in accepted terms, semi-Fowler's. So how do we break these terms apart? Use the meaning of parts to decipher the term. Define in this order. So you want to look at the suffix, then the prefix, then the word root. It can be kind of tempting to just go right into the word root because that's the mainly what the word's about. And we want to get right to the point, but if we're missing some of the suffix or even maybe the prefix, we're missing a lot of information, right? So try to refrain from jumping right to it and try to decipher words as this goes. Let's get at it. So the nephropathy. Pathy means disease. O is a combining form. Nephra means kidney. So nephropathy is disease of the kidney, right? So again, it's asking us to try to, okay, what's this suffix first? Okay, if we got the suffix, then we can kind of see what this O is all about, right? That O is just the combining form, and then we see that they're talking about the neph, right? The nephrons of the kidney, right? We know it's this relating to the kidney. So this is just the way that they recognize breaking it down, right? And to be perfectly honest, with a lot of the terms that we're going to use and are really expected for you to know, we're going to be looking at that prefix first. The hypertension, hypotension, tachycardia, bradycardia, pre-post. Those pre-terms are going to be huge. And then obviously the root word. I'm not saying that the suffixes aren't important, but you'll just see the ones that we utilize more readily. You're just going to kind of come across and know. And the suffix is going to be really important in a word like this that you're not sure about, right? Then you're really going to have to break it down. But the ones that just come right out at you and like, oh, okay, I understand what the cardi means for the heart, tachycardia, bam, I got it, right? Those ones you don't necessarily have to use this technique to break it apart. You just kind of you just learn it and memorize it. But it's when you come across something that you're not sure about. So let's go on another one, right? So dysuria. Ia means condition of, dis means difficult, painful, or abnormal, depending on what context it's in. And then ura means urine. So dysuria, painful urination, right? It may look like and that's the other thing to be kind of careful for too, is some of these words are fairly short, but it's actually three, separate terms put together to come up with this term, right? So make sure that you take your time, if it's a word that you don't know, to try to break it apart as far as the suffix, the prefix, and then to look at that root word. Because that's the kind of nice thing, is it does follow these rules, right? Here's another one, hyperemesis. And again, does this one have a suffix? No. So, you're kind of looking in there, itis, I don't see anything, right? So then we go on to the next one and we look at hyper. Well, I got that. That's excessive. What's emesis mean? Okay, well, I remember emesis bag. Okay, vomiting. Hyperemesis, excessive vomiting, right? So it's another means to pick up on some words that at first glance may seem overly complicated, but then when you break them down, they have a very specific analgesic. So what is an analgesic? Okay. We got an, analgese, ick. Ick is the suffix pertaining to, an is the prefix without or absent of. So, and then algese, word root meaning pain, analgesic pertaining to no pain. Right? And to be perfectly honest, when I look at analgesic, I just think of analgesic medication, pain medication, right? So my brain doesn't necessarily break it down in this fashion that we're describing. But if it's a word that you're not sure, especially if you're in that testing environment, realize that's the best tool to try to get the most out of. What does this word mean when you're not sure where to start? Go to that suffix, go to the prefix, and then the root word. So abbreviation, acronyms, and symbols. Shorthand use for communication, right? So often these will be in the written form. A lot of the stuff that we get is typed now, so some of these, symbols and such may have come out of use, but you still may see it, right? It's developed for speed. Problem is, if you may be trading this speed for accuracy. As we spoke of before, never trade speed for accuracy. It may take longer for you to say in layman's terms if you need to, but if you're not sure the right medical terminology to use, then default onto that. It's more important that we're accurate. And use only commonly understood acronyms and abbreviations to minimize errors. So how do we know if it's a commonly understood acronym or abbreviation? Well, we can look it up, right? Even just a simple Google search of common medical abbreviations, and they'll show you a couple. And I would behoove you, even before you even try to utilize one of these, just look up some of those so you can kind of see how many are out there and actually how confusing they can really be, right? So yeah, they may be quick, but if the other person doesn't know what you're intending on saying, then it's almost pointless in terms of communication. Some agencies will limit the use of abbreviations, um, so just understand your local protocol. Um, Abbreviations will take the place of words to shorten notes, documentation. Use only the accepted ones to avoid confusion or errors. Be familiar with the ones that you utilize, right? All right, so last but not least would be symbols, sometimes used as a shortcut, just kind of like the abbreviations as well. Some examples of some symbols would just be like an up arrow or a down arrow for increased or decreased, just a slash for negative. Maybe even the drawing of the female or male sign. If you've seen Austin Powers, you'd be familiar with the little male sign. Um, but you can see also that these are um, they can be kind of confusing, and if you're not familiar with them. But again, look at your book, and we'll have some examples of some common symbols that are used, as well as some of the common root words, prefixes, and suffixes. Now, again, I'm not requiring that you guys have all these memorized, right? All these charts memorized, but you gotta understand how these words are made so you can break them down, and also the ones that we talk about in class that we're utilizing all the time: hypotension, hypertension, tachycardia, tachypnea, right? Tachycardia, fast heart rate; tachypnea, fast breathing; cyanotic, that they were blue, right? You got to be able to pick up on some of these medical terminology, and we'll be referencing them a lot in class, and utilize this textbook as for what it is, right? If you come across a term that you're not sure about, this would be a good page to bookmark here on page 164 for these. It's the start of some of these common root words, combining forms, prefixes, and suffixes. So now that's going to be the conclusion of the lecture here. Now we're going to go into the, questions. And so, which one of the following components of a medical term conveys its essential meaning? Would it be a prefix, a suffix, a word root, or a combining vowel? So hopefully you chose C, the word root. This conveys the essential meaning of the medical term. Prefix usually describes location, intensity, right? Hyper, too fast; hypo, too slow. The suffix will indicate a procedure, condition, disease, or part of speech, or itis, inflammation, right? Combining vowels, they're just used to connect them to make them easier to say. Okay, prefix can indicate color, conditions, body parts, or procedures. A. Right? Prefix are used to indicate colors, numbers, and position or direction. Suffix will indicate those procedure, condition, disease, or parts of speech. And as we look through these two, see how kind of test taking strategies get used to multiple choice, right? These are very kind of black and white, and they'll get more complicated, but we'll start to talk about deciphering some of these if you're not sure, right? When it starts to bring up procedure, condition, diseases, those kind of all sound the same. The odd one out was those colors, so that would be the best guess if you were to try to do an educated guess and you weren't sure what was the correct answer just off reading it. The plural form of the word bronchus is, right, so we got bronchi, bronchuses, bronchiaces, or bronchi. And hopefully you chose D, bronchi. When a word ends in us, the plural form will end in I. For words that end in A, the plural form would be the A, kind of like vertebra, vertebrae. When a word ends in IS, the plural form will end in ES. Words that end in X or IX, plural form will be ICES, for apex, apices. So again, these rules, they're good to know, but also you're going to get used to the plural forms of some of the more common words that we're going to be using as EMTs. The statement, the lungs are superior to the bladder, indicates that the lungs are closer to the feet, surface of the skin, head, or trunk. C. The term superior is used to indicate a structure is closer to the head than any other structure. Inferior is the term used to describe a structure that is closer to the feet. Superficial is used to describe a structure that is closer to the skin than another. Proximal is used to describe a structure that is closer to the trunk in comparison to another. Movement of the arm toward midline is referred to as flexion, extension, adduction, abduction. Answer is C. The term adduction is used to describe movement of a structure towards the midline of the body. Flexion refers to the bending of a joint. Extension refers to the straightening of a joint. Abduction is used to describe movement of a structure away from the midline of the body. A body part that lies closer to the midline when compared to another is considered to be medial, distal, lateral, or proximal. Answer is A, medial, right? The term medial is used to identify a body part that closer to the midline when compared to another. Distal is used to refer to a body part that is further away from the trunk in comparison to another. Medial and lateral refers to closer to that imaginary midline. Proximal and distal refers to extremities. This is used to identify a body part that is on the belly side of an anterior surface of the body. Is it deep, superficial, dorsal, or ventral? D, ventral. It's used to identify a body part that is located on the belly side or anterior side. Deep describes that between deep and superficial. Dorsal is that back side, that posterior side, right? A dorsal fin, right? You place a patient in semi-Fowler's position for transport. This means the patient is lying on his or her back, lying on his or her stomach, sitting at a 45-degree angle, sitting at a 90-degree angle. C. Patient is sitting at a 45-degree angle is said to be in semi-Fowler's position. Patient is said to be supine when they are positioned on his or her back, completely straight, right? Like with the legs flat, head flat. When a patient is lying on his or her stomach, they are said to be in a prone position. Think of like a sniper in a laying down position, right? They're prone. If you have a patient sitting at a 90-degree angle, that's sitting up very, very straight, right? You place them in that high Fowler's position. So most commonly, I know this is specifically 45-degree angle, but for most transport positions, we talk about it being in the semi-Fowler position. A laceration located on the plantar surface is on the sole of the foot, palm of the hand, back of the body, front of the body. Plantar A. Plantar refers to the soles of the feet, while palmar refers to the palms of the hands. Dorsal or posterior is used when referring to the back of the body. Ventral or anterior is used when referring to the front of the body. When using abbreviations, acronyms, or symbols, an EMT should be familiar with those used in your agency. Use only those that are medically accepted. Use them to shorten documentation. All of the above. D. Before using abbreviations, acronyms, or symbols in your documentation, it is important to know which ones are accepted for use by your agency. You should only use those that are medically accepted so anyone who is reading your report can understand what you are saying. To minimize the length of your documentation, you can use abbreviation, acronyms, and symbols. Thank you for listening to the Chapter 5 Medical Terminology. If you have any questions, comments, or concerns, please email me, matt.falkowski@hotmail.com. And the password to be able to access the Chapter 5 quiz will be tachycardia. So good luck with the quiz, and again, please feel free to email me with any of the questions, comments, or concerns you guys have. Okay, thank you.